do I know if I have a thyroid disease? That's the question we're going to be talking about today. Okay, so thyroid disease is very prevalent in the United States. And in fact, we say about 4.6, almost 5% of the whole US population has thyroid dysfunction. Whether that's high thyroid, that's low thyroid, thyroid cancer, there's something going on with the thyroid. Okay, so that's what we mean. Now, how do I even suspect that it's my thyroid? Especially since, I see my doctor once a year, every year, and they tell me that they've screened my thyroid and my thyroid is fine. This is one of the most frustrating things for patients when they've gone to their doctor, they've had the annual physical, they're feeling all these weird symptoms, they're not feeling great, they know something is off, they don't know what's off, but the doctor comes back, their blood work looks fine, and they've been told, no, it's not your thyroid. So the thyroid is a metabolic gland and it sits right here in our neck, right? It's a butterfly-shaped gland, and what it does is it regulates a lot of the metabolic function of our body. And when we say metabolic function, we're talking almost 200 things, okay? How we sleep, how we wake, how we burn fat, how we store fat, how we digest, how we regulate temperature, how our heart beats, how we absorb, how we reproduce, right? How our bone health is. It talks, how our muscles are going to function, whether we're going to feel tired or have energy. Even our cholesterol levels, your skin, your hair, your nails, just goes on and on and on. Okay, so this gland is not to be ignored, right? Kind of like you can't ignore your heart, you're not going to live very long. You can't ignore your lungs, you're not going to live very long. Well, if you ignore your thyroid, you're not going to live very long either. Okay, so that's kind of like the importance of this gland, right? And it is we call it a bread and butter of our internal medicine, right? Because it affects everything we do, everything, right? So if we're talking about your kidney, we want to know how your thyroid is. You're talking about your heart, we want to know how your thyroid is, right? You're talking about your brain, we want to know how your thyroid is because it affects all of it. Okay, so that's how important this gland is, okay? So now, once we know that your doctor is screening your thyroid, but you're still not feeling right, we want to go to the next level of expanding that thyroid test. So most doctors check a test called TSH, thyroid stimulating hormone. And it is very important to screen first, right? We don't want to assume that you have something, so we screen. So the screen is just, hey, let's see if the brain is even talking to your thyroid, right? So then we check and we see that this hormone is being released in the right quantity. Okay, well then that's fine. That means that part of it is fine. But what I don't like about that test is that it just tells me that the brain is knocking on the door of the thyroid. It doesn't tell me if the thyroid is responding. So I like to check a couple more things to make me feel better about the fact that I've actually checked the thyroid. And that is to check the hormones that are supposed to come out of that thyroid after that TSH knocks on the door. Okay, so those thyroid hormones are called T4 and T3. So I like to check the free levels of those hormones to see how active they are, how much is floating around and actually getting the job done. So if those are not being checked on your blood work, that you need to request, okay? The next thing I like to check to go a little bit farther, making sure I'm not leaving any patient undiagnosed, is looking for the thyroid antibodies, okay? So we look for the thyroid stimulating immunoglobulin called TSI. That tells me if the thyroid is overacting. I look for the thyroid peroxidase antibody, we call it TPO, tells me if the thyroid is underacting. We also check another one called anti-thyroid globulin antibodies. Okay, so we look at those, we call it ATA. Okay, we check those as well. So once we check those, we are going to then find out if the thyroid is truly okay. Because look, the American Thyroid Association, as said with their statistics, that about 12% of the US population will develop some type of thyroid disease in their lifespan. 12% of the population, okay, that's more than 1 in 10, okay, is going to eventually develop thyroid disease. So I don't want to just do the routine TSH, especially as my population of patients age. I want to look for these other factors, these other things in the blood work to make sure I'm not missing them. I'm not underdiagnosing them, right? Because a lot of the struggle that we experience as we age can sometimes be, blamed on aging, but it might be an underlying undiagnosed metabolic problem, okay? So there's actually a test that I do in my clinic. When patients come in, I put them on a body composition scale. And this body composition scale, luckily, also checks what we call the metabolic age. Okay, so you'll be surprised how many patients I find that metabolically, they're like twice their age. Like they're older, right? And the patient's always shocked when they see that number. Like, what is this? What does that mean? I'm like, yeah, something's off metabolically that we've missed. Let's go figure it out together. Let's run some additional tests. Let's find out maybe genetically something is off. Let's go find out. And that has really helped us uncover a lot of patients with metabolic problems, hormone problems, infections, chronic infections, different things that might be causing them to age prematurely. Okay, so that's an aside. Back to the topic. So basically, with the thyroid, we have to do an expanded panel to really uncover the condition. So once the condition is uncovered, now we can start really addressing it. So we check T4, we check T3, we check TSH, we check TPO, we check TSI, we check ATA. So now we got all these antibody levels. We know whether you're high thyroid, low thyroid, normal thyroid, and we go from there. Last thing I always want to tell my patients is this. Just because you fell within the normal range doesn't mean it's normal. Just because you fell within the normal range doesn't mean it's normal. Because what is the normal range? The normal range is a number that is given to us by the laboratory. They came up with this number based on the average number of patients that they've tested, and if the patients fell within this range and this range, that becomes a new reference range. Is that a normal? We don't know. So for everybody, their normal is different. Some patients are going to feel normal closer to the higher end of the range. Some patients are going to feel better in the middle of the range. Some patients are going to feel better on the lower end of the range. And there's some patients, believe it or not, we got to drive them out of that range for them to actually feel better. So we've got to actually pay attention to each patient and weigh their symptoms and see how they do as we give them therapy. I hope this has been helpful, but this is one of the ways that a lot of patients are getting undertreated, underdiagnosed when it comes to thyroid disease. Okay, I want to go in the second part of this and talk about what are those actual thyroid symptoms that patients feel that lets us suspect that the thyroid is not working right. Okay, join me on the next part of this video. Okay, look for part 2.